Is learning about Medicare and all of its parts overwhelming and exhausting you? Are you eligible for Medicare in the next year and wondering what you should know before you sign up? Or have you been diagnosed with Parkinson's and you're wondering how to best utilize your Medicare benefits specifically for your Parkinson's symptoms? Well, today we're chatting with a real-life Medicare guru who's here to answer all of your burning questions. She's quite amazing. Her name is Danielle Roberts, and she is a Medicare Supplement Accredited Advisor. She's a member of the Forbes Finance Council, and she's the chief blogger at Boomer Benefits. You're going to want to write that website down. Her agency is licensed and appointed in 47 states, and she's helped tens of thousands of Medicare beneficiaries understand their benefits since 2004. Danielle writes articles on boomerbenefits.com, and her column at Forbes helps readers like you navigate the Medicare enrollment process and live to tell about it, which we love too. So if you have questions about Medicare, please put them in the comment section below. A lot of you who knew this interview was coming have submitted your questions, and I've got them all written down for Danielle. If you don't have questions, that's okay. Just say hello in the comment section below so we know who's tuning in. And if you're new here, welcome. My name is Sarah King. I'm a passionate Parkinson's physical therapist and advocate. And here at Invigorate, we help you get out of overwhelm and into action by connecting you with the tools and support you need to thrive during the course of your Parkinson's journey. So if there's anything that's going to be overwhelming, it will definitely be Medicare. And so today we're going to help you get out of that kind of overwhelm so you can best navigate your healthcare system and learn how to best take advantage of your Medicare benefits. So if you have not had a chance to read two of the amazing blog posts that Danielle's written for Invigorate, they are over on the website. The first one is titled, "How Does Medicare Cover Parkinson's Disease?" And the second one is titled, "Physical Therapy Guidelines Under Medicare in 2019. So depending on when and where you're watching this, you can find the links to those blog posts in the comment section below or in the description around this video. And today I invited Danielle on to do a Q&A. She's going to take your questions about Medicare and answer them. So if you don't get your question answered today, check out her blog posts or head over to her blog. But if you have questions, today is your chance to get them answered. So put them in the comments and we will get to them. So let's go ahead and bring Danielle on. Let me click a few buttons here, and she is here. Welcome, Danielle.
Hello. Thank you for having me. How are you today?
You bet. Oh, I'm so excited to have you. I cannot tell you how beneficial this Q&A is going to be for our community. I know this is a fringe conversation for our Parkinson's community, but as we know, people who have been diagnosed with Parkinson's are typically in the age of Medicare, if not going to be there soon. So this is going to be so helpful for people. How are you?
Terrific. And I'm really happy to help your community today. You're right about the types of questions that come in, and anyone who's aging into Medicare is normally overwhelmed anyway with all the stuff that you have to learn. You know, you spend your whole life being given your benefit selections by employers, and then suddenly you're thrust into this national healthcare system and you need to learn all of this stuff. And when you have a chronic illness complicating that whole process, it's even scarier. So anything I can do to allay some of those fears and help your members be confident about how great the benefits really are under Medicare is joyful. It's a joy for me to participate in.
Awesome. Well, let's start with the basics. Maybe you could give the people watching like a 2-minute rundown of Medicare 101 just to kind of get us warmed up to what exactly Medicare is and who might be eligible.
Okay. So it was originally designed to be a health insurance program for people age 65 and older, which it still covers today. But in the 70s, we also added another group. So anyone that has a disability that you have Social Security disability income benefits for 2 years or longer, those folks can also qualify for Medicare in America now. And originally, the program covered about 19 million people, and today we have over 60 million people on Medicare. So it really is covering a large segment of the population. You age into Medicare at age 65, whether you have enrolled in Social Security or not. So you're eligible for Medicare regardless of whether you're taking those benefits early or you're postponing them to get a larger check. If you are already taking income benefits when you turn 65, Medicare will assume that you're no longer working and will just automatically enroll you into Parts A and B, which those two parts together are called Original Medicare. It's your hospital and your outpatient benefits. And if you aren't yet taking your Social Security income benefits, then you are responsible to contact the Social Security office, and you can enroll down at their office in person. You can call them and have them mail you an application. And of course, they have an online application now where you can just go right to their website and set up your Medicare there. And you will do that in the 7 months surrounding your 65th birthday. So 3 months before your birthday month, the month of your birthday, and then 3 months after is the 7-month window during which you are responsible to sign up for Medicare unless you have some other creditable coverage, like you're still working for a large employer and you're going to delay your Medicare benefits. You certainly can do that. But most people will enroll in usually at least Part A when they turn 65, because your hospital benefits you've been paying for your whole working life. So you might have noticed on your little paycheck that you've gotten all these years, there's some little Social Security and Medicare taxes that come out of every check. And if you've worked at least 10 years in the United States, then you've already prepaid for Part A. And so 99% of people don't pay anything for that at age 65. So if anyone on the group today is still working and wondering, do they need Medicare benefits? Then of course you would be able to enroll in the Part A, and it's not going to cost you anything, and you can have that coordinate with your group insurance. And then later you can add the Parts B and D. So that kind of goes over the basics of enrollment and some of what the things are. What you should know about coverage is that Medicare covers just about anything that's medically necessary. So although they don't cover things like routine dental, vision, and hearing, if you have something wrong with your eyes, if you have glaucoma or you have cataracts, those are going to be things that are ordinarily covered by Medicare. Of course, physical therapy is medically necessary, and that is covered, as is just about any doctor visit or injury or illness that you can think of typically is going to be covered. The coverage is actually quite full. They don't cover cosmetic things. So, if you get some fillers for your frown line, that's not going to be something they really care about covering. But pretty much anything else that falls into the realm of medically necessary is going to be covered by Medicare, and Medicare covers about 80% of your needs. So you'll have some deductibles and copays and coinsurance to pay, but on average, about 80% of your medical needs are covered by Medicare.
And when you talk about it, it sounds really bright and shiny. I tell you what, and honestly, I've already learned a little bit. I knew quite a bit about Medicare, but I've already learned some things about Medicare in our first 2 minutes. So
Great.
This is going to be really, really great. Okay, so you talked about Medicare parts a little bit, A and B and D. Are there other parts?
Yeah, so there's 4 parts total. Part D is the newest part, which rolled out in 2006. And so a lot of people on the phone may not know this, but prior to 2006, we didn't have any retail drug coverage in Medicare at all. They would cover medications given to you in a hospital or clinical setting like chemotherapy. They didn't cover anything outpatient. So I remember back in 2005 sitting down with clients and saying, there's no drug coverage at all. Like they would just pay out of pocket ridiculous amounts of money. And so fortunately that was fixed under the Medicare Modernization Act, which was signed into law in 2003 and rolled out in 2006. And so Part D is voluntary, and you can sign up for that drug coverage to help you with outpatient prescriptions. And then Part C is optional because that is the Medicare Advantage program. So I mentioned that Medicare only covers about 80% of your expenses. So most people will sign up for some form of additional supplemental coverage to cover that other 20%, to cover that hospital deductible. So if you have a hospital stay, you're not shelling out $1,300 every time. And so there's traditional Medicare supplements, and then there's the Medicare Advantage plans, and that is also called Part C of Medicare. So not everyone enrolls in that. If you don't intend to get your benefits through a Medicare Advantage company, you would never enroll in Part C. And that, of course, makes everything a little more confusing because it's a part of Medicare, but you sign up for it with a private insurance company. Same thing with Medicare Part D. It is a part of Medicare, and Medicare tracks your enrollment, but it is something you'll purchase through a private insurance company that's offering the plan that you want.
Okay. And this is just a question for me, and I know that it comes up in our Q&A later, but how do people go about researching which places maybe to purchase this side?
Sure. Yeah, it can be really overwhelming. So a lot of people will start with Medicare's website, which is medicare.gov, and you can read a lot of the things there. Medicare also has a handbook that they publish. So if you really like reading government language, you can read the 100+ pages of the handbook. Something that we've done here with Boomer Benefits is to try to put all the terminology in very easy to understand language. So our website is a great place to go and just kind of learn a lot of the basics. We have a post where we usually direct people to start. It's called 4 Simple Steps to Understanding Medicare, and it's kind of the manifesto, the initial read, if you will, about Medicare. There's also a lot of great YouTube videos. So one of the neat things about the technology that we have today is that you can go right to YouTube and type in the word Medicare and it'll pull up a lot of videos. We have a YouTube channel, but there's also several other great agents that I know that run pretty good channels where if you are a better audio visual learner than a reader, then that's another great way for you to just kind of get the basics. Now, the decision about which type of supplemental coverage to get is one that you should take very seriously because you may only get one chance at it. And especially for folks that have Parkinson's, this is going to be a disease or disorder that will prevent you from being able to get a Medigap plan later on. So when you first become eligible for Medicare and you sign up for Part B, your Part B effective date triggers a 6-month open enrollment window during which you can sign up for any Medicare supplement plan, also called Medigap. Those are the same thing. And these pay after Medicare. So Medicare pays its share, sends the remainder to your supplement company, which pays its share. And then if there's anything left over based on which plan you chose, then you would be the third payer in that scenario. During that 6-month initial enrollment window, you could be deathly ill, undergoing dialysis, and you would still be awarded you would be approved for the supplement plan. So it's specifically intended for people who do have a chronic illness so that they are not finding themselves without being able to get the supplemental coverage. Now, after that 6-month window is up, then you cannot, then afterwards, in most states, to get a supplement, you'd have to answer health questions, and any type of chronic illness will cause the insurance company to decline you. The good things about Medicare supplements are you can use them at any provider that takes Medicare. So if you travel and you need to be able to have doctors in Kansas and also in California, you can see any doctor or hospital. There's no referrals. You don't have to pick a primary care provider. It's a great freedom of access, and it doesn't matter if your supplement is from Blue Cross or Humana or United Healthcare. You can use that anywhere if you enroll in a Medicare supplement. There's plans that you can purchase that are extremely full coverage. For example, Plan F covers all of the gaps in Medicare. So you would pay nothing for your doctor visits, nothing for your specialist visits, nothing for surgeries, nothing for physical therapy. It literally covers every deductible or gap in Medicare, and you just pay nothing out of pocket. Wow. Plan G is a similar, really comprehensive one. And so you can imagine if you're coming into Medicare and you're worried about an illness and how it's going to be treated, that type of full coverage can be really appealing to people. Supplements do not include drug plans, so you would get a standalone pharmacy card for your Part D, and that's kind of how that route works. Now, you can imagine that also, since this coverage is so thorough, there's a premium associated with that. So for example, someone here in the Dallas-Fort Worth area that was turning 65, female non-smoker, she might be able to get a policy for $100 to $120 a month. And in Washington and Florida, you would pay twice that or more, just depending on the area of the country and how expensive medical care is in those areas. And sometimes that's out of reach for people living on a fixed income. So the other option is the Medicare Advantage plans that we talked about. And on those plans, there's only one health question, which asks about end-stage renal disease. So if you're not in kidney failure, you can qualify for that plan. And so if someone misses their 6-month Medigap open enrollment window and they didn't know that, and then they can't get a policy, Advantage plan is a good one to look at. The premiums on those plans are a lot lower. You can even find plans that have a 0 premium, meaning they don't charge you anything more than what you're already paying for Part B. You have to be enrolled in A and B and continue paying for Part B, no matter which type of supplemental coverage you choose, Advantage or Supplement. The Advantage plans cost less up front, but on the back end, you're going to have copays more as you go along, and you're going to agree to use a network of providers. So the important part about this is you're really going to want to make sure that your important doctors, neurologists are in the network, because if you enroll in a plan and then they're not in the network, depending on the type of plan, you're either going to pay a lot more to see them or you may not be able to see them at all. And so this is one of the things that we tell people coming into Medicare, and a good reason to work with a broker like Boomer Benefits is we can walk you through all the plans in your area, what the options are, the pros and the cons, and help you decide, based on what your budget is, what your comfort level, your peace of mind. Are you going to be sleeping better at night if you've paying a little more for a policy that's going to cover everything? You don't have to worry about any bills if you come out of the hospital. Or are you going to sleep better at night if you don't have a premium coming out of your paycheck every month that's going to be a stressor on your budget? So that's a great way to get all the information in one place. Certainly, you could call a bunch of insurance companies and get quotes on your own, and you can do research on Medicare's website. You can even enroll in Advantage plans and Part D drug plans on Medicare's website. Just keep in mind, when you enroll and you don't use an agent, whenever then you have questions or problems on the back end, if Medicare denies a claim or if your pharmacy refuses to fill one of your medicines, you're going to be calling 1-800-Medicare and dealing with that on your own. Whereas if you enroll through an agent, it doesn't cost you a dime, but you'll have someone in your corner when you run into those kind of things.
Mm-hmm. And I don't know what the agents are like, but I would love to have you as, I would rather be talking with you or a real human being.
Sure.
Instead of trying to figure out just calling the website or calling the toll number. So that was excellent.
Good.
And you guys, the website, Boomer Benefits, is amazing. I've checked it out. And they've got webinars all the time. They've got courses, lots of awesome information. So make sure to check that out. Some people are checking in and saying, like Kama said, I'm so grateful for the information I received for Plan G. Lots of people are saying they already are learning a lot. This is great. Okay, so yay. So I think you covered my basic questions. I'm going to go ahead and hop into the Q&A part. Okay. So again, you guys, if you're watching and you have questions that you haven't submitted yet, put them in the comment section below. If you're loving Danielle, give her a big thumbs up or a heart. Give her some love. That's the way we applaud here on Facebook. So first question came from someone in California who asked, why does Medicare no longer cover my annual physical exam at Kaiser?
Yeah. So prior to 2010, Medicare didn't cover any physicals. They didn't cover an annual checkup at all. So there used to be a Medigap plan that would actually provide that. And then what Medicare figured out was if we skip this preventive physical every year and you have someone that's not going to the doctor very often, we're missing things until they're already a problem and it's costing the Medicare program a lot of money. So in 2010, they added Medicare's version of the physical, which is very slimmed down type of physical benefit. You're going to go to your doctor's office. He knows exactly what things are included. There's going to be a little bit of lab work, and he's going to ask you some questions, and he's going to look in your ear, nose, and throat. It's that kind of physical which is covered. The type of physical that some of us have been used to with companies prior to that is much more comprehensive, and Medicare, the taxpayers are paying for this program. So they do not cover things like here in DFW, we've got the Cooper Clinic, and it's a $6,000 physical, and Medicare will giggle at that and say, no, I don't think so. So the type of physical that you can get under Medicare, while it's going to cover some of the basics, it's not going to be as extensive as what you might get elsewhere. So if you're interested in that kind of physical, I always encourage my own clients here to ask the clinic or the doctor where you've been getting that in the past if you can pay cash. So for example, hey, I'm on Medicare now. Medicare doesn't cover this. Is there any type of cash discount that you can give me if I pay cash? Clinics and doctors love to not have to file insurance paperwork, and you'd be surprised at how many of them will negotiate a cash discount with you if you would go ahead and proceed with that physical there. But that's the reason. It's really just a funding issue why Medicare doesn't cover a richer physical.
Mm-hmm. Awesome. The next question is, and we're going to roll through these because we have quite a bit and I don't want to keep you here all night. Medicare Part D plans. Someone said that the copay changes on a whim for them. It's so difficult to choose because the Part D companies can change their copays. Who knows what will remain the same? So can you speak to that at all?
Sure. Yeah. So all Part D companies have certain guidelines that they must follow. For example, they all have 4 stages: deductible, initial coverage, coverage gap or donut hole, and catastrophic coverage. When you enroll in the Part D drug plan in the beginning, even if you enroll online, they're going to give you a summary of benefits. It's going to show you, depending on which of those 4 stages you're in, exactly what your copay would be for certain tiers of medications. So one of the things that we do here, we enter all the medications into Part D for we will handle Part D for our Medigap policyholders. We enter those into the system. We let Medicare tell us which plan is going to give you the lowest annual overall out-of-pocket. And then we go through the summary and we show you, okay, you've got 3 drugs in tier 3. Here's your copay in the initial coverage level, but if you hit the gap, here's what's going to happen. So most likely one of 2 things is happening there. One is that instead of a copay, there might be with some plans a coinsurance. So you might have, say, tier 4 non-preferred brands. Instead of charging you a flat copay, they may charge you 33% or 25%. And so that's why you're not always going to know exactly the cost of that medicine. Also, the pharmacy that you fill it at makes a big difference. Most of them have preferred pharmacies and non-preferred pharmacies. If you use the preferred one, you're going to pay a lot less money than you would if you use a non-preferred pharmacy. Also, when you hit the coverage gap or the donut hole, the percentage that you pay changes. And in fact, this is so funny this question came up. So I literally just recorded a Part D video right before it's going to be probably released tomorrow. So you can find this, guys, on YouTube if you want to. It's going to discuss the donut hole. But you might have a drug. Let's say the drug costs $400 if you were to just pay cash for it. And this drug is a tier 3, and on your plan, the copay for that drug is $40. So in the beginning of the year, when you're in the initial coverage level, you're going to pay $40 for that every time. But if your drug spending goes over $3,820 in 2019, you fall into the gap or the donut hole. So this $3,820 is you and the insurance company together. Every time you fill a medication, Medicare tracks the total amount that drug costs and how, including what you paid and the insurance company. So if you go over $3,820 in a year, you fall into the gap. Now, when you're in the gap, you're going to pay 25% of the cost of that brand name drug. So using that same example of a $400 medicine, you're going to go from a $40 copay to a $100 copay. The thing that you can do to prepare and always know what's coming is you can track your spending. So the Part D company, after every time you fill a medication, is going to send you an explanation of benefits. It's going to show what you paid, and it's also going to show you how much progress you've made toward the gap, how many dollars you have left before you enter the gap. And that way you can be prepared and know, okay, this is going to be my last fill. Next time I'm going to be in the gap, it's probably going to cost me a little bit more money. Also, a lot of the carriers, I'm surprised that more people don't use this, but almost all of them will have some sort of online program that you can sign up for. So for example, Humana has My Humana, and you can log in there and you can get that breakdown anytime. You can see every single medication, where it hit, how much money was counted towards your gap, and at the very least, you can be prepared for that. Now, one other tip that I would give your listeners is sometimes when you're filling a generic medication, you can actually get that drug cheaper if you go to goodrx.com. And you can get a coupon for your medications there. And I'm not sure if you've ever discussed this on your program before, but when you're filling a medication that's a generic, you're using up valuable dollars that you only have 3,820 of them before you hit that gap and you have to pay more. So if you can fill a drug for $10 on GoodRx and it would have cost you $30 on your plan, not only are you getting the drug cheaper with the GoodRx coupon, but now that money is not going against your total dollars that you have to use before you hit the gap. So I always tell people to compare the two prices. And if there's any drugs that you can fill using the GoodRx coupon that don't hit your Part D, you can save those Part D dollars for the brand name drugs where they're pretty expensive on GoodRx, and you really need those discounts that are coming from your Part D company.
Those are amazing tips. You said that you're doing a video more in depth of Part D on Boomer Benefits YouTube channel.
Yeah, so we have 2 videos up already, and I just recorded both of those pretty recently. One is how Medicare Part D works, and one is how and when to enroll in Part D. And then the one that I was fixing, that I was working on earlier today, is called the donut hole. And it explains just what the donut hole is, why it exists. And something that a lot of people don't know about this donut hole is nobody likes the donut hole, right? We never like reaching a stage where we get to pay more. However, in 2006, when you hit the donut hole, you paid 100% of the cost of your drugs when you're in the gap. So paying 25% is way better than what we had just 12 years ago. And that number has been slowly decreasing, and now it's at 25% and it'll stay there. So even when you're paying 25%, the insurance company and Medicare are covering the other 75%. There's a discounts that come from the manufacturer built into that too, but you're always paying the smaller amount of that drug. So when you see the numbers, you can see, yeah, my portion costs me a lot, but you can also sometimes look at those numbers and be grateful that you didn't need to cover the other, 3/4 of that cost.
Yeah, awesome. Some good tips. And I see some people in the comments, Kama and Mark are both saying that they love goodrx.com. So
yeah, it's awesome.
I had heard about it. Yeah, I'd heard about it. So check it out, guys. All right, let's see. The next question. I'm going to skip a really long one and get to some of the shorter ones so we can knock those out. This one, if I return to Part D, actually, let's see. I take Rytari and Govorvi for Parkinson's.
Okay.
Both are expensive and relatively new. My prior Medical Advantage plan took these drugs off formulary, as did many Part D only plans. If I return to Part D, how do I find coverage for these drugs when they can be taken off of formulary? Can you explain maybe what formulary is?
Yeah. So every insurance company, every Part D plan has a list of covered medications, and all of them have to cover certain medications. So there's some things like anti-cancer, antipsychotics, antidepressants, anti-seizure, those type of medicines, all of them have to cover. And then in every other therapeutic class, the carrier must offer at least 2 medications so that if you develop a new health condition, you have something there for your doctor to treat. Well, when you have drugs that are older and generic that treat something, and then these newer drugs come along, the carrier only has to offer 2 in the therapeutic class. So if they can offer ones that are generic, that's going to reduce what they pay out, they typically do. Now, that being said, for example, any Part D carrier will have, a dozen or more blood pressure medicines that they offer, even though they're only required to offer 2. So when you have a super expensive drug, you will sometimes see that if there's any other drug that could treat that same condition, a lot of the carriers won't offer it. So in that scenario, all drug plans have what is called an exception process built into them, meaning if you have a drug and your doctor has already tried you on some of those other medications and they're just not as effective, you can file an exception with the Part D carrier. And this is where your doctor sends in documentation. Hey, I tried this drug. They worked mediocre at best. This drug does amazing for my client. It's really important that we get this medication covered. Now, it's not a guarantee, but we do see a lot of the exceptions get approved. And then the carrier decides what tier to put them in. So, they may put it in a tier where you're going to pay 25% or 33%. But still, as I mentioned earlier, the carrier is always paying the bigger portion of that drug. So don't be afraid to use the exception process. Every fall, though, when you have drugs that have not been covered, every fall, it's really important to run an analysis. That's something we do for all of our clients here that call in. We run the analysis for free because just like your person mentioned there, they change the coverage every year. So you might have a plan that's working great for you, and then next year they're dropping your favorite pharmacy or they're dropping one of your important medications. And so now we need to go back to the drawing board and we want to look to see if anyone else for next year is covering that medication on the formulary. Now, it could be on the formulary, but requiring a prior authorization. So that just means there's going to be a little more paperwork from your doctor to prove why you need that drug. So the first thing we would want to do is look to see if we can find another plan that is still covering those medicines. It might be a more expensive drug plan, but sometimes that's still worth it if it's going to cover the medications that you need. If none of them are covering that medication, then that means there's either a generic that's out for the same medication, and usually when that happens, almost all of them will immediately default to the generic the following year. And then that's where the exception process comes in again. If you're someone that is responding better to the brand name drug, then that's the process we have to go through. So the main thing I always tell people is you have to remember they're still insurance companies, right? And they're there to make a profit. And they actually make very little money on Part D, because if you have a drug plan that costs you $30 a month and you're filling 4 or 5 medications, that premium isn't coming anywhere close to covering what that carrier is shelling out for your medications. But they also get part of that funding, around 73% comes in from Medicare, and then there's the manufacturer discounts. So they're trying to stay profitable with what they have to offer. That being said, the exception process, they can't just routinely rubber stamp a no to that answer. They have to be able to show that they are approving enough of the exceptions to be legitimate. If they don't, then at the end of the year, you have the opportunity to, when they do the survey, to give them low marks. All drug plans will have a stars from 1 to 5. So another thing to do is to look and see that you're not enrolling in a plan that has a 2-star rating. That means members in that plan were dissatisfied. And you always are going to have members who have a drug exception that doesn't get approved are going to be dissatisfied, and that could result in low stars. So look for drug plans that have a 3-star or higher rating too, that are covering that medication, and then I would try that route.
Awesome. Okay. I think that answered probably a lot of questions for a lot of people. This one is short. Will Medicare cover legalized medical marijuana or CBD?
We get this one all the time. So right now, no. It'll probably be a while before we see Medicare covering that kind of stuff. However, they've made some big strides recently. One in the physical therapy arena, and telemedicine is kind of on the rise now too. So it's possible that as the nation kind of moves more into acceptance of that we may see more coverage from Medicare going forward. But at the current time, I don't believe they do.
Okay. Is there any, this is kind of a spinoff, as CBD is kind of a supplement. Mm-hmm. Do you have any insight into if people are buying a lot of supplements or kind of doing more wellness activities, are there ways to, maybe it's not covered under Medicare, but to kind of decrease that financial burden in any way?
Yeah, on the supplement side, I'm not sure if there is a way. I know that with the actual medications, we always have people check with the pharmaceutical manufacturer. We look at what programs are out there that might be able to provide the medication cheaper. I know that my dad has a diabetes medication, and even with his Part D plan, he was able to get a 12-month pass with this card they gave him, and now it's only $10 when he fills the medication instead of $47, where it would have cost him on his drug plan. So we check there. But on the supplement side, I'm not aware of any programs, at least in the Medicare related arena, that cover that kind of stuff. Medicare doesn't cover supplements or vitamins. It's very rare that they'll cover that type of thing. So you're probably going to be in terms of supplements, you're going to be working on your own to see where's the cheapest place I can get that.
Okay. All right. This next one comes, and it's got a little bit of PT and OT.
Okay.
So what is the length of time home health, PT, OT, speech, and home health aides services are allotted and covered by Medicare, and the same for outpatient, PT, OT, and speech therapy? this person says her mom has advanced stage Parkinson's and she's going to need PT and OT for the rest of her life. Being that she is retired and no longer able to obtain employment, paying for therapy is not financially feasible. She has United Healthcare Medicare Advantage plan.
Okay. So there's rules under Medicare for what Medicare itself will cover, but anytime you enroll into a Medicare Advantage plan, you're no longer getting your benefits from Medicare. So the Advantage plans can charge you differently. And there's no blanket plan for United Healthcare. The benefits are going to be different on every single plan that they have around the country. They may be somewhat similar, but because the cost of healthcare in that county is different than it is in a different county, you have to look in the summary of benefits to see exactly how much you're going to pay for physical therapy. And if there's any limits in that summary of benefits or in the evidence of coverage, or do they list any limits at which after you've had so much therapy, they'll end you. Now, on original Medicare, one of the great strides that happened this year was they removed the hard caps from the physical therapy. So it used to be where you could only have X dollars per year, and then the therapy had to stop while your therapist tried to file an exception to get more. Now, once you go past the soft cap of $2,010 for physical and speech therapy together and $2,010 for occupational therapy, after that point, then you are just making sure that what is being billed is medically necessary. And there is a point where a review board could come in and stop that therapy. But I really don't think we're going to actually see a lot of that happening because there's really not a designated process yet for how that's going to happen. So this was a really big improvement in Medicare saying, first, we're going to do away with the hard cap. But the other thing is it used to be the therapy had to show medical improvement. And of course, this is not the case for people with conditions like PD or MS. So they changed that now to where medically necessary is okay to, you can prove that even if what the therapy you're given is just maintaining a level of balance, mobility, flexibility. And so this is, of course, great, especially for people with Parkinson's. However, on your Advantage plan, they don't have to play by the same rules as Medicare. So when your mom signed up for that plan, she would have had a summary of benefits that would have been given to her by the agent or the company. There's also an evidence of coverage. And in that summary of benefits will be a physical therapy section that tells you it's $30 for each visit or $40 for each visit, whatever that cost is, the copay that you'll pay. And it will tell you in there if they have any type of cap or limit for the year. Usually we don't see that. It's usually just you're just going to pay the copays as long as you go along. And then, of course, all Advantage plans have an out-of-pocket maximum built in to protect you. So if your spending total for the year goes beyond that out-of-pocket maximum, then the insurance company has to cover all the remaining costs for Part A and B services for the rest of the year. So you could have a lot of the AARP United Healthcare plans have a $4,000 out-of-pocket max or $4,900, I think, for last year. But they change again in every county. So you'll have to look at your summary to see exactly what those numbers are for your mom's specific plan that she enrolled in.
Okay. So there's some general rules and then there are very specific rules according to
that's right.
people's plans. Okay. Mm-hmm. This one is in that camp. So just in case we missed a little facet of it, how can we get PT to continue for our mom with Parkinson's? Is there a way she can get it twice a week indefinitely? And from what you just said, it's kind of like, I feel like you covered all facets. But the indefinitely part, can you maybe speak to that?
Sure. So what happens now is once the spending goes beyond $3,000 for the year, that's when the treatment can still continue, but it's subject to post-payment medical review, which means there's a point there where an independent review board can come in and say, this is a lot of therapy. And that board exists so that, of course, you don't have therapists or facilities out there abusing the Medicare benefit. It's, however, a lot better than what it used to be. So you want to look at what the total cost of for each of those therapy visits, what the total cost is that's being billed to Medicare. And you can see that on your Medicare summary notice. So after each treatment you have, you're getting a notice that comes out to you in the mail and it shows you exactly what was paid. And so you'll know that you have up to $3,000 in a year before there comes a point where someone could discontinue that. However, if it's medically necessary and the documentation is there and the doctor or therapist can prove that it's necessary, there's no longer any hard limit. So chances are that she may be able to continue that therapy indefinitely. Another thing too, if you're not familiar with how to read the statements, if you're on original Medicare and you have a Medigap plan, if you're getting your benefits directly from A and B, you can also sign up for a mymedicare.gov account. And so then you don't even have to wait for your explanation of benefits. You'll be able to see immediately, as soon as that therapy visit is filed and paid, how much that was. And so then you can do some quick calculations to see, if I'm doing this twice a week, how long is it going to be before I run into that $3,000 cap? And then at that point, you're just going to know there could be something that comes later that says, we're going to end this here for the rest of the year.
Okay. And I am curious about, for myself, when people go over that $3,000 limit, say they've spent another $1,000 on therapy, they're up to $4,000, it gets reviewed by the board. My understanding is that a board can decide that they're not actually paying that, additional $1,000 and can actually bill the patient. Is that correct?
Yes. So they can,
Okay.
and that's why they call it a post-payment medical review. So they can initiate a review. And so what you want to make sure of is that you're working with your doctor and therapist, when you've hit that 3,000. And then from there on out, you want to make sure that those records clearly document the medical necessity. Because when the board comes to review that, if there's 2 sentences in there, they're going to say, somebody's trying to get a lot of money out of delivering physical therapy. That's how they're going to look at it on the review board. But if your doctor or therapist has made very detailed notes that are detailing, the measures of maintaining, or in this case, maintaining balance, flexibility, all the things that a therapist is documenting, want to make sure those notes are really thorough, so that if they did come back and say, hey, we're going to make you pay this, you can appeal it and say, no, look, here's what we've documented, and we've gone to great extent to show that this is really necessary therapy. So just make sure the records are good so that you have a good leg to stand on if you need to appeal that.
Okay. And those usually get sent to the clinic where people are going to physical therapy, or directly to the beneficiary?
They may notify the beneficiary, but they definitely notify the clinic. So that's where it'll come in. And that is what gives your therapist the heads up of, let's stop the therapy temporarily while we try to deal with whether or not we're going to be able to get additional benefits approved.
Okay. I remember when I was working in the outpatient clinic, I worked at a hospital system, and we had this discussion over and over again, and the hospital would actually absorb, if that did happen, the hospital would absorb it. So I didn't recall any beneficiaries getting bills, but the review definitely does happen. All right. So this person says, I'm 58 on private disability. I'm covered under my wife's insurance, and she goes on Medicare in 2020. Can I get Medicare if I've been turned down for Social Security disability?
Not until you turn 65. So you can only get the Medicare if you have had 24 months of Social Security disability income benefits. So in that scenario, what you would do is you're going to go to healthcare.gov, and you will apply for an individual health insurance plan through the Obamacare or Affordable Care Act. And there are, depending on the income, assuming now your wife is retiring, now your income that you have coming in at that point in your life may be low enough that you qualify for a subsidy, which offsets a lot of the premium. We see sometimes people on these ACA plans that are only paying $20 or $30 a month for their health insurance because their income is low and they're getting that subsidy. And that's going to be what's going to bridge that gap between the time that you lose that group insurance and go on Medicare.
Okay. And there's a pretty long question. I'm not going to read it all, but there are pieces of it that I want to kind of parse out. And I don't remember who posts this, but it's someone who lives in New Jersey. And that doesn't matter for you, Danielle, but if you're watching, I'm going to spare Danielle the whole question. And if you want to submit a longer question, anyone, please go to boomerbenefits.com. They have an amazing service team. You can ask them your specific situation. But There's some concern in here about Medicare being a primary payer versus a secondary.
Yes.
And it's a lot of a spouse is covered, and this person is asking questions about kind of the overlap between primary and secondary, and being someone
and how
on
that works.
someone else's insurance. Can you speak to that a bit?
You bet. So if you are working for a company, or your spouse is working for a company that has more than 20 employees, and you have group health insurance through that company, either because you're the worker or your spouse's, doesn't matter if it's your spouse or your coverage, it's the same. If there's over 20 employees, then that insurance is primary and Medicare is secondary. And that's a scenario where most people will just sign up for Part A because your group coverage already has outpatient and drug benefits. And then this saves you from paying the $135.50 a month for Part B and whatever Part D premium that you would pay for the plan that you chose. So you can delay that coverage. And then when you get to the point where you're both going to retire and you don't have access to that coverage anymore, then you have a special election period, which allows you to pick up the Parts B and D, and there's no penalty for late enrollment. If you work for the opposite, which is a small employer under 20 employees, then that coverage is secondary to Medicare. So when you turn 65, it's super important that you enroll in both Parts A and B during that 7-month initial window, or else you will not only have a late penalty when you do finally sign up for Parts B and D, but you also have to wait until this general enrollment period that comes around every year in January, and your benefits don't start until the following July. Sometimes people miss this. They think they know the rules for the 20 plus and they think it applies to them, but they're working for a small company. We had a gentleman a few months ago that called us and had worked for a small company. Now he was 72 and facing a 70% Part B penalty for the rest of his life because he just didn't know that if the company was small, he should have enrolled in Medicare at age 65. So that's how the primary and secondary works. For people that are 65 and older, if you are on Medicare disability, the numbers are a little different. It's 100 employees and over.
Okay, I think I saw some of those details in this question. So I think that probably answered the question. Is it the same for Part D plans as well? The 65?
So for Part D, you sign up in the 7-month window when you're first eligible. Okay. And then even though Part D is voluntary, if you don't have other creditable coverage through an employer or the VA, when you do enroll later, they're going to hit you with a penalty. The penalty accumulates at 1% per month for every month that you waited to enroll. So if you waited 5 years, you would have a 60% higher penalty for the rest of your life. So it can really add up. If you're not taking a lot of medications, then we tell people, sign up for the cheapest Part D plan that in your area, just so that you can make sure you don't get caught without having, with a penalty later on. And you're going to need some medications for sure if you have a chronic illness like PD. So you're going to want that coverage anyway. Yeah.
Okay. This is so good. Okay. We've got some people, those cover a lot of our questions that we got before this live. Good. I'm just kind of looking them over. Someone asked, is it true that persons with Parkinson's can no longer be denied coverage due to their lack of improvement? And I think they're talking more about physical therapy. We covered that.
Yep. Yes, great improvement. That's such a good thing that Medicare did on that last year.
Yes, I could not agree more. As a physical therapist myself, let's see. Becky asks, I will be 65 next January. What are my steps in enrolling for Medicare? So do you have I have a feeling you have a video or a webinar or something. Can you direct Becky to that?
You bet. So if you go to our website, which is boomerbenefits.com, we have 2 things we can offer you. The first is when you hit the homepage, you'll see a pop-up immediately in the bottom left corner. You can sign up for our 6-day Medicare email mini course. And so this is 6 emails that come into your email inbox, and each of them will have a short written lesson and then a video of yours truly teaching you how to enroll in Medicare, what Medicare covers, what Medicare costs. And so that is a really great series just to familiarize yourself. And then also we do a webinar here every 2 weeks. I do a new to Medicare webinar. It's completely free. And this is just for people to be able to come to a hassle-free environment and be able to learn what they need to know without, insurance agents pounding their mailbox and calling them off the hook. People on Medicare turning 65 get bombarded by so much mail and they get overwhelmed very quickly. So boomerbenefits.com/webinars. You can sign up for our next webinar, and that's a live webinar where I am teaching all of the basics you need to know in about 60 minutes. And we do go over how to sign up for Medicare, where to sign up for Medicare, when to sign up for Medicare. That's all in there. And in addition to that, we have pages on our website. The Apply for Medicare page has all that same information. So just depending on how you like to learn, video, webinar, reading, well, that should cover off all the choices you have to learn what you need to know. And if you want someone to walk you through all of it, give a call to our agency or fill out one of the forms on the website. One of my team will then reach out to you to go over your individual options personally. And don't be afraid to tell them, I have Parkinson's. I'm very concerned. I want make sure I have good coverage for this. And they will advise you, which plans are going to provide the level of benefit that you really need. And our service is free. And then on the back end, if you ever run into these problems that we've been discussing, the drug exceptions, Medicare denies a claim, our team provides free support on that on the back end. So you never have to call Medicare and figure this stuff out. You call the client service team. When you get a bill in the mailbox, you never pay it. You immediately call us. We will check to see if you really owe that. A lot of times you don't. And the doctors and clinics who sent those bills by mistake will certainly take the money if you send it. So we always tell people that's a free service we offer on the back end to make sure that you're never alone in dealing with Medicare.
And for full disclosure, everybody, Danielle didn't reach out to me to invite herself onto a Facebook Live broadcast. I reached out to her. So it's not like she is just going on anybody's, Facebook Live and just, blasting all of her stuff out there. I found her information really valuable. We got connected through a different Facebook group, and she's on because I asked her, and there's no, any financial relationship here. It's honestly just finding a resource that I felt like you guys would find really valuable. So amazing webinars, amazing articles. I can't speak highly enough of it. So go check them out. And I just wanted to make sure that everybody's really clear that this is all
It's
awesome.
all free. All the help will be free.
It's all free. Yes. Okay. Bonnie asks, can you get drugs from GoodRx in Canada?
You can. If GoodRx offers a Canadian version, or if you just find a pharmacy that you want to get the drugs in Canada, it'll be completely outside of Medicare. So that would be something that you're just doing on your own. However, I will tell you, we have a handful of clients that swear by the Canadian drugs and how cheap they are. So if you can get a prescription and you can order the drugs directly from Canada, and that's cheaper than what you would pay on Part D, go for it. There's plenty of people out there that have asked that question, and you're not breaking any rules. It's just that Medicare isn't going to cover it. So you pay that out of pocket.
Okay. Great question. Mary asked, does that take income into account? I don't know exactly what that was in response to, but okay. Is there an income type of
Yeah. So she probably was referring to the premiums. So 95% of all beneficiaries in 2019 will pay $135.50 a month for Part B. However, if you earn more than $85,000 as an individual or $170,000 as a joint filer, there are 6 brackets or tiers above the base level that you will pay more for Part B and D than everyone else. And on our website, if you go to the Medicare costs page, which is under the New to Medicare dropdown, there is a whole breakdown of those different tiers. And so somebody in the highest tier, which would be someone earning more than $500,000 as an individual or $750,000 as a married couple, they pay $460 per person for Medicare Part B. So it can be a lot more expensive, and they're going to be basing that on your household adjusted gross income from 2 years ago. So they're going to look at your 2017 tax return because it takes the IRS a while to get all the records over to Social Security. And so if you were earning more then and now you earn less because you've retired, there is an appeal process that you can go through. You can file an appeal with Social Security. I did this for my own mom. It was super easy. And we presented the evidence that she had retired and now she earned less, and they immediately dropped her premium down. So there's even free ways to appeal for that. And we have a blog post and a YouTube video about how to go and do that as well.
Awesome. Okay. Ron asks, seems having TRICARE for life using Express Scripts for Part D coverage has never mentioned a donut hole. Are there other differences in this coverage?
Yes. So on TRICARE for life, if TRICARE for life, if their vendor for Part D for their drugs is Express Scripts, because that is a retiree plan, you probably do not have a donut hole on that. So the individual plans on the marketplace, they all have a donut hole, but retiree coverage that you get from TRICARE, or if you have veterans benefits, or you get benefits from Indian tribal, or you have retiree benefits or a company that you retired from, those typically don't have a donut hole. And most people on TRICARE don't need Part D. So you would just use the benefits that come with TRICARE, and you will only pick up a Part D plan if, for instance, for some reason TRICARE didn't cover one of those medications and you wanted to purchase Part D, you certainly could, but you generally won't need to. They have pretty good drug coverage on TRICARE for life.
Awesome. Okay. Let's see. Daphne asks, how do I get a Medicare card?
Oh, good question. Okay. So if you have not yet enrolled in Medicare, when you do, it'll take them about 2 weeks after you submit your application before your card will show up in the mail. If you're already on Medicare and you have lost your card, if you just go to Google and type in Medicare replacement, and that first pop-up that comes up there, the first listing, will take you to the Social Security page where you can order a replacement. And it's pretty easy to do. You can also call 1-800-Medicare and order the replacement over the phone.
Great. Awesome. And then this is the last question that I see. It is Kathy. She says, when can I apply for Medicare? I was diagnosed 3 years ago. I think we covered that, but just to reiterate, the 7-month window for everybody.
So you can apply 3 months before your 65th birthday. And then your benefits will start on the first of the month in which you turn 65. You also have 3 months after your 65th birthday. And then if you apply after your 65th birthday, there's a little bit of a lag time. There's a month or two before your benefits will begin. Now, just in case she was asking, meaning she has had Parkinson's for 3 years and she's not yet eligible for Medicare based on age, then in that you would apply for Social Security disability. And if you are awarded disability income benefits based on your Parkinson's or any other reason, you would have 24 months before Medicare, before you would become eligible for your Medicare Part A and B benefits.
Okay.
And lots of good, lots of good enrollment information too, both on our YouTube channel and the website. So if you feel like you're furiously writing all this stuff down and you're worried you're going to miss that, all of that data is also on our website, that you'll be able to find it after our call here today ends.
Definitely. The last one I wanted to ask was just what goes on in the January time period for Medicare?
Okay, sure. So Medicare has election periods. You have your initial enrollment period. There's a special enrollment period if you worked for a while and then now you're adding your benefits. And then there's a couple of annual election periods. So the most common one that people know is in the fall from October 15th to December 7th. That's for changing your drug plan or your Advantage plan. It has nothing to do with Medigap. So if you have a Medigap plan, nothing's changing there for you. From January to March 31st, we have a new election period, and this is for people who are enrolled in a Medicare Advantage plan who do not like the plan. So if for any reason you are unhappy with that Advantage plan, from January 1st to March 31st, you can make a one-time change to a different Medicare Advantage plan, or you could also return to original Medicare and enroll in that and add on a Part D drug plan. Now, keep in mind, if you're on an Advantage plan and you want to go back to original Medicare, it's easy to leave the Advantage plan and get back to original Medicare, but to add a Medigap plan at that point, you're going to have to answer health questions. And if you have PD, you're probably not going to pass the underwriting. So you want to be very careful not to leave an Advantage plan unless you're in a state like Washington where they have year-round open enrollment for Medigap and you're going to be able to get approved for it. You want to be careful there. Coincidentally, Medicare also has a general enrollment period that's the same dates, January 1st to March 31st. And that is just for people who completely missed their 7-month window. Like they missed that their mailbox was full of 700 mailers and somehow they got past the 7-month window and they never signed up for Medicare. I don't know how it happens, but it actually does. If that happens to you, then you apply for Medicare during the general enrollment period from January 1st to March 31st every year, and your Medicare benefits then will begin the following July. If you didn't have other coverage, there's going to be a penalty in there, but that's how you would use that period to get the Medicare in place.
Okay. That's perfect. And
yeah.
You may have just answered this, but Kenneth asks, can you get Medigap at 65 if you didn't when you qualified by disability earlier?
Yes. So people who have the disability earlier, they are pretty much the only group of people that get 2 6-month open enrollment windows. They get one when they first activate Part B, and then they get one when they turn 65. So if you couldn't get a Medigap plan while you were under 65, because maybe in your state they don't sell Medigap plans for under 65, or they're really expensive for under 65, now you're in that same group as everybody else at age 65. You've got 6 months to sign up for a Medigap plan, no health questions asked. And so that's a great time to change from either an Advantage plan that you've been on or a really expensive under 65 plan over to a normal one that's going to be priced a lot better.
Awesome. Thank you so much, Danielle. This has been so helpful. And if you're watching and you love this, give it a big thumbs up. If you found it beneficial, please share it with someone that you know, even your family, to help you navigate Medicare. Share it with your support group. And definitely share boomerbenefits.com with them as well, because there are a million other questions I'm sure you're going to have. And I know Danielle's team would love to help you answer those. So thank you, Danielle, for coming on.
You're very welcome. Thanks for having me. I enjoyed it.
Yes, we'll see you hopefully again soon. All right, everybody. See you later.
Bye.